Hi everyone. My presentation this week or my flashcard is on scabies. So the disease process for scabies, it's all pretty straightforward. It refers to a species of mite, which is Sarcoptes scabii, and which is able to burrow, mate, and lay eggs under the epidermis layer of the skin. And then if a person has a large number of mites and the skin starts to scale or crust, which is kind of an exacerbation of the normal symptoms, this is known as crusted Norwegian scabies. And complications can arise if not treated in the form of secondary staphylococcal or streptococcal infection. The pathophysiology is mostly reliant on or reflects the life cycle of the mites itself. So the female burrows into the person's skin, lays eggs, and then the male mites can also burrow, and then they mate with the female under the person's skin. The female dies after she lays the eggs, and her life cycle is about 4 to 6 weeks. And the male dies after after they fertilize the female. And then the larvae emerge and go to the skin surface, repeat the cycle over again. Like I mentioned, the female's life cycle already, and then the larvae hatch within 4 days of being laid. Risk factors for scabies are pretty global and not seen in any real one particular population necessarily. However, living in a group facility, is or like a shared environment consistently puts you at higher risk for scabies if there was an outbreak. So this would include places like nursing homes, which is somewhere you might see the crusted Norwegian scabies as they could go untreated or unnoticed, depending on where they are in the body. And then prisons, childcare centers. And it's estimated that the worldwide prevalence is about 200 million people. And the signs are always topical, and that includes burrows appear on the skin as tiny light brown lines, often with small vesicles, erythema, inflammation, and pruritus caused by the damage done to the skin by burrowing and the presence of mite and fecal material in the burrow. They can occur on any part of the body. However, particular common sites are between the fingers, the antecubital region, and along the waistline. So I have some photos here. So this is kind of not one of the places I listed, but if you think about it, they're kind of like to be in like crevices. So in between the fingers and then, right here in the axillary area. And then diagnostic testing. So it's typically identified just by sight, probably if you were a seasoned practitioner. However, healthcare professionals can also scrape the person's skin to identify either the mites, the eggs, or the fecal matter under a microscope. And then obviously those crusted scabies that I talked about earlier are identified by the scaly crusts and fissures caused by the mites. And that is it. So I hope everyone enjoyed my presentation.